Hey everyone, it's Dr. Brad here again, and I have my great friend from chiropractic school, Dr. Emily, joining with me today. Hey Doc, how you doing?
Hey, I'm doing good. Thanks for having me.
Hey, no worries. Thanks for taking time out of your busy Friday afternoon to say hi to me. Um, Before we get rocking and rolling, can you guys give everyone a good idea of who Dr. Emily is and what you do for your community?
Yes, so obviously I'm a chiropractor here in Southern Illinois. I just moved back home about 6 months ago. I previously practiced in Louisville, Kentucky, where I got my feet more wet in the pediatric and pregnancy world, and I'm very grateful for that experience. And I'm happy to be bringing it back home to Southern Illinois. So yeah, I am one of the few around here that work with pediatrics and pregnancy, and I saw that there was kind of a lapse in that gap of chiropractic here. So another reason why I came home, and now I'm getting integrated with a bunch of OBs, midwives that are in a lot of OB clinics, and then a lot of professional midwives out in the community, doulas, lactation consultants, yoga instructors, everything under the sun, just trying to be really involved and spread the word that there are some good resources around Southern Illinois for mamas and babies.
Yeah, and it's funny because I constantly will pick your brain if I have like a kiddo walk into my office, be like, hey, what do I do with this person who has tongue tied or something like that? And you've been a huge resource for me. And whenever I tell folks, chiropractors can actually help out, the pregnant moms or the kiddo who was just born yesterday, all the way in between adulthood. Can you kind of really touch into that because, and you can correct me if I'm wrong, but chiropractors who specialize in pregnancy and pediatrics, that's not exactly the most common field of expertise in chiropractors. So can you
Yeah,
kind of
so
dive into that? Yep, sorry about that.
no, you're good. Okay, so with pregnancy, a lot of patients are and pregnant moms are experiencing those sciatic like symptoms, maybe carpal tunnel, de Quervain syndrome, all the above that you can think of, kind of that a general patient would walk into your office with. And when they're pregnant, OBs and other doctors and medical professionals, there's NSAIDs that are not to be prescribed during those times. So it's kind of like they're also at a standstill as to what can I do for this patient? How can I help them? So chiropractors aren't seen on like that front runner. So trying to elevate that in a community and be more resourceful in that aspect. But overall, with pregnancy, touching on the sciatica with pregnancy, the round ligament pain, tailbone pain, all the above of just carrying that big belly and that baby in there to really help them have a successful pregnancy, whether that be, helping mom's pelvis alignment to position a baby, right? Kind of the secondary aspect of using Webster specifically for pregnant moms is making that position in their body more prominent. So baby has the ultimate room to move around in there to the best position. Then overall, when you get baby into that best position, moms have decrease in labor time, decrease in subjective overall pain, and just more comfort and confidence going into their pregnancy. So that is my ultimate goal with mamas. There's endless benefits to chiropractic during pregnancy. And then it teeters on when you help a mom. What I've learned is that they hand you their babies. So that's when I became rehearsed in babies. So I was like, okay, what am I going to do with babies? And like, how do you do babies? Because it's completely different than it is a pregnant mom. You don't hear the cracks and the pops. It's very gentle. Their nervous systems are synapsing about like 2 to 3 more times faster than an adult. So they are just creating a bunch of new just neural connections within their own nervous systems. And they change so quickly. It's night and day with babies, which is amazing. But some of like the common themes that I've seen in my office have been colic, constipation, what else? Reflux, overall, just like the crabbiness, the tight hips from sitting in the car seat, sitting in those bumbo seats, strollers, carrying them on your front side. Babies that get tight and can't move around a lot, they experience just kind of that fussiness that we've been seeing an increase in. But
Well,
yeah,
Doc,
so that's kind of to tie it all together.
there you go, Doc. I love it. So it really, I mean, the passion that you're displaying is clear. I think anyone who's listening to this, they can definitely sense how much you love treating this population per se. What's your chiropractic story? How'd you get into it? Because not many people wake up one day is like, you know what, I want to be a chiropractor for pregnant mamas and peds.
Yeah, so I did not know that I wanted to be a chiropractor, period. I played soccer my whole life growing up, literally since I was 4. And then in high school, I had a really bad back injury and I had a stress fracture in my foot in high school. I had the straight up SI joint dysfunction from falling in a hole on a field. And it just, all the things just kind of like set me back, and it would just make me angry as an athlete because I didn't want anybody to tell me no, basically. So then I went to our family chiropractor growing up here in town, and that has been the most beneficial experience that I could have went to my performance on the field. And then that carried over with me in college. So I played collegiate Division I soccer at Illinois State. Shout out to them, go Redbirds. Um, so I played at ISU, and I would have some lingering back pain, just, lifting weights, trying to become stronger, be more dominant on a field. I played a pretty dominant position in that center mid, and I was 5'3", 120 pounds, like holding my own against 5'9", 160-pound woman. So trying to get an aspect of recovery that was different than just physical therapy and icing and heating and ice baths and all the above. So I advocated a million and one times, like, I need a chiropractor. I need a chiropractor. I need a chiropractor. Finally was able to get to one, right? So that has tremendously in my junior and senior year had made a difference in my play. I could finally withstand practice without my low back hurting. And then performance wise, was performing to my junior year was like the top I think I'd ever been in soccer. So when my junior year came around or my senior year came around, and it was like, what am I going to do after, undergrad? I was like at a loss of words. I wanted to go into PA school in the medical field. My mom's a nurse, so I grew up around all that medical aspect of life, and I wanted to help people, and I wanted to see a positive change in people's lives. And I didn't know how I wanted to do it. However, I found out that I didn't want to do it through medication, because I don't rely on medication unless it's literally medical necessary. And it's kind of like my last line, right? My last lifeline. So I was like, I could do physical therapy. However, I'm not very good at doing my own physical therapy. So I was like, maybe you shouldn't really do that. And then I was like, well, chiropractic. Like, I went to a chiropractor since I was like 12, 14. Like, why didn't I think of this before? Didn't even have to shatter to know that I was like, oh my gosh, I want to do that. So I went and toured Logan, and then I was close to home. My family is from St. Louis area. So it kind of made it more easy for me to choose that. And then also being able to see the lasting changes in people and that impact that would last them consecutively, not just putting a band-aid on something, was something really important to me, because in my years as a soccer player, I felt like everything was a band-aid. So kind of growing into that aspect. And then peds and pregnancy, I didn't know I wanted to do it either. I worked in my preceptorship was with the VA, and I absolutely loved it. I still love it to this day. Um, and I just have a very good passion just for everybody who has served for our country. I have a lot of family and friends that have done that, and it'll forever be near and dear to my heart. But transitioning off of that, it's very hard to be in the VA system. So I was like, you know what? I need my own experience. I don't want to just succumb to one population and give, give, give. I want to give to everybody. So that's when I was like, well, what area do I lack in? And it was peds and pregnancy. So my last year of school and then my first job as an associate in Louisville, I kind of just hunkered down and I tried to learn as much as I could about peds and pregnancy. And flashback to like trimester 2 in chiropractic school, I wanted to be that family chiropractor. And so here I am. I love my family and I love my community, and I just want to make it all come together in a little circle.
That is phenomenal. And to give, I'll be the first person to admit, I don't know a thing about peds or pregnancy. I know some things here and there, but if we were to go toe to toe, I would get, knocked out of the ballpark any day of the week. And I know that there is this huge movement in really making sure that kids are, having a strong, healthy back. That's just going to affect not just how they develop, but overall how they will present themselves later on in the future. And there's this large course of study now, like, and I'm sure you're familiar with it, Logan University, which is our alma mater. They just started a master's program in pediatrics and pregnancy in that area. So it's a field that's definitely growing per se. And I imagine you probably have quite a few challenges when you're kind of expressing that to a new mama who's never even seen a chiropractor, or that OBGYN who's even hesitant to send you some patients, what are some of the challenges of being a pediatric chiropractor?
Yeah, so just overall communication, right? Instead of just going and doing patient education, I found is one of the number one crucial things that can be a game changer in your practice. So I always educate my patients. I always tell them, hey, let your OB know, right? Like that you're coming to see me. This is what we're working on. I also send them reports. So like making that connection and breaking kind of that barrier as like you get that persona like, oh, they can't work together. Well, you can work with anybody who you want to work with, right? We're working together now and we're a few miles away. But, you have to kind of bridge the gap and make that connection. And you have to be that standout person that, nobody else is going to do it. So, like, I'm going to go and do it, right? So, educating them is my number one thing, letting them know to tell their OB that they're coming to me. And then, yeah, that has been a game changer for me. People really appreciate just the education point of chiropractic because they don't know much about it and they want to know. That's the thing too. Is like you have to be open for that question to come. And then if you don't have an answer, sometimes I'm like, honestly, I don't really have a good answer for you. That might be an answer that you ask your OB, or let me research it and get back to you on it because we're learning together. As for pediatrics, again, letting them know that a lot of cognitive function comes from just playing outside, right? Like that's where you learn to crawl, jump, walk, use the monkey bars, everything like that. All of those have a spot in our brain that we're working with. So if a kid falls, right, we have that pain gate theory. You make that new pain gate channel. So you make new channels every which way. Well, we have to teach our kids like, oh, that's okay to sometimes be in pain from things. That's normal. However, we can rechange that and it takes time. And chiropractic care can teach your brain basically how to remap that pain gate cycle and kind of decrease that pain that you feel and then overall just eliminate it. And then once your brain has found that eliminated, it's kind of like, oh my gosh, like what do I do? Like I feel great. Like my brain's trying to make that another channel. We don't want that, but how do we keep it going to feeling great, right? So just trying to educate mamas as well, and teach them that there's a lot neurologically that chiropractic can do that we just can't see from the outside, but on the inside, for sure, it's working.
You really brought up something that really kind of caught my attention regarding that, regarding how like when kids process pain, how we kind of have to reassure them that this is all right. It's nothing like crazy per se. And I'm sure you know this as well with a lot of rehab techniques, that's why I'm a big person in that in my practice. A lot of what we do is based on baby development. We're teaching how to diaphragmatically breathe, how to roll, how to eventually get back to crawling. And everyone laughs at me. It's like I'm a kid again. It was like, well, yeah, we're reteaching you these primal instincts that you had when you were once a child.
Yeah,
And the same thing that you even discussed about how telling your patients about pain isn't necessarily a bad thing. And it seems like we're on the same line with like pain is more no different than like a fire alarm, if you will. For a fire alarm to go off, there has to be fire, but that fire alarm is a good thing. It tells us something's going on. It's just how we associate that with like a bad or a good experience changes the outcome completely.
absolutely.
Yeah, so I really, really think that's a really good potion notion that what you just mentioned. And it's I mean, you're the kind of doctor, and I even kind of picked this up whenever we went to school together, was that you're the kind of person that like you'll keep it at a level that all your patients can definitely comprehend and understand, and not use these big fancy doctor terms that we paid hundreds of $1,000s to use, right? Um, but yeah, so give me an idea though of necessarily speaking, like let's say you do have that kiddo who says, I fell and I hit my back while I was playing on the jungle gym. Like, how do you guys approach that to get into an idea as like they have that match get lit and it's not becoming a wildfire, if you will?
So approaching it as like it's okay that this is normal response, really, number one is like mom needs to know like that's normal. Also, kids are literally like jello. They bounce back so quick. It is unreal, right? Like I wish that I bounced back whenever I like fell and felt so good after maybe like one treatment, but now it takes like two or three for me, right? But yeah, so reassuring moms that their systems, their blood flow, their energy, again, it's going 10 times faster than our own. So trying to let them know, like, hey, it's 1 or 2 treatments. Ice is going to be your best friend. And then just overall watching it, right? Like I might adjust them normally a couple times. Maybe it really just depends on what it is. And then working that musculature. And then I take them through that range of motion, right? Like we do, I'll have them go in a squat, or I'll have them go down to touch their toes, right? After I adjust them, do you still feel that pain? You know, we recheck again. When you do it the first time and you have pain, after I adjust you, I have you do it again. And then typically people have no pain. That just retrain their cycle, and that pain gate cycle they didn't even know existed, right? So all I did was just remap their brain to realize, oh, okay, I can go and do that without pain now. Again, it reassures mom, like, oh, okay. So we adjusted them for whatever misalignment is going on, and they just did what they would do normal every day, and it worked. I don't need to worry about it. They feel good, right? So just that's that patient education again. That's educating the mom and sending them home with maybe some exercise. I always give my moms 1 or 2 things to do with their kids, whether it's babies, infants, even adults, right? We always send them home with 2 or 3 things to do at home. But
Love
yeah.
it. That is, and then, and like you mentioned, homework is going to be huge for these kind of folks, of course, because what you do in the clinic is great, but once they walk out that door, you have zero control of what they do. And so you want to definitely make sure they're not taking steps backwards, if you will, and they're going to continuously make progress, even if they are a kiddo or a pregnant mama. So this next question, and just by talking with you, you've had a lot of experience from your history with your past chiropractor to going to Logan to college soccer, etc. You've had a lot of ups and downs, I imagine, even in your professional life as a chiropractor. What would you say has probably been the number one thing has taught you the most that you think everyone should learn at one point in their life?
I would say to be open to constructive criticism, and kind of changing your mindset of like, oh, I'm never going to get better, or I can't do this. It's that same aspect of like, yeah, you can keep putting a band-aid on and a band-aid on and a band-aid on, but when is enough enough, basically? When are you going to make that difference, right? I'll use myself for an example. Mine would have to be my biggest challenge for my own individual growth has just been getting back into the gym, right? Like complain about fatigue, complain about feeling like crap, eating like crap, right? Not drinking enough water, all the simple things that are so easy for you would think are so easy to do, but you could just get swamped. Well, when are you going to take, like, right? We're running a practice here. When are you going to take the time to actually go and do it yourself? There has to be a barrier. You have to say enough is enough. So enough is enough. Now, what am I doing? I'm going back to the gym. I'm kicking butt, drink plenty of water, not eating crap. But it's just that mindset. You have to have that mindset, and you can't really, in a nice way, you can't feel bad for yourself, right? You have to grow. Life is all about growing. And if you don't grow, what are you doing?
Yeah, exactly, Doc. Like if you're not taking care of yourself, how on God's green earth are you gonna be able to take care of your patients?
Exactly.
My patients tell me all the time, it's like, Doc, you look tired. I'm like, I am. And it's like, we need to take a day off. And I'm just like, yeah, I do need to take a day off. All right, let's go ahead and get you treated. Anyways, but yes, I completely agree
Yes.
with you. We'll talk. Well, Doc, we're learning quite a lot about you, from your upbringing through college and then your professional training and then through your associateship to your own gig now, necessarily speaking. Um, and I know I'm taking up a lot of your time and I won't take up much more, but I got a couple more questions for you. We're learning a lot about, Dr. Emily, the professional, the doctor, the pediatric specialist, the pregnancy specialist. But if we want to know more about Dr. Emily, the person, if you had to give us your top 3 books that you'd recommend, what would they be and why?
Well, they're sitting right next to me, so I can remember them,
There
right?
you go.
Um, my first one is going to be That You Are Not Good Enough by Ali Stuckey. She's a Christian author. She just talks basically about how you take that sob story. Instead of saying you aren't good enough, you are good enough, and it's fine. You're fine. And she puts it into perspective, and she has that Christian spin on it, and she's amazing. I love her podcast and whatever with that. My other one is Never Split the Difference for professional growth, and then oversubscribed as well for professional growth. And I have one more, so this is going to be four, but because I need it for my pregnant mamas, and it's just good overall for that postpartum. So if I have any mamas listening who are postpartum, pick up this book. It just got released. It is called Your Pelvic Floor Sucks. Even if you're not postpartum, like maybe 2 or 3 years postpartum, your pelvic floor still probably sucks because it never healed. So that's the one I'm reading now, and I'm ready to implement more of that into my practice and hopefully build a little protocol for that.
Well, that is awesome, Doc. I've read. Are you referring to Never Split the Difference by Chris Voss, the FBI agent?
Yes. Yes.
That book is phenomenal. I mean, I've read it like 3 or 4 times now, and I can't. I every time I read it again and again and again, I learn something new all the time. So I love
Right.
that. That's great. Okay, Doc. Well, you know, a lot of people have learned a lot from you. Especially what you can provide to their kiddos, or even, you know, their pregnant wives, sisters, fiancés, etc., and whatnot. If someone wanted to know more about you, what would be a great way that they can get a hold of you or reach out to you?
My Instagram page is si.pregnancy.chiropractor. And then as well as Facebook, Southern Spine and Rehab is our Facebook page. Just send a message on there. I look at those two things all the time. I'm constantly posting on there. You'll probably hear, "Hey, Dr. Emily," like multiple scrolls. But yeah, those are probably the best places to reach me at.
Perfect. Well, hey, Doc, I really appreciate you taking time out of your busy day to come by and say hi. I mean, I felt like I was in pediatrics class again in Tri 7 because I'm just learning so much all over again. It just during school, it went in one ear and right out the other. And I really wish I would have kind of retained some of that knowledge. But hey, that's why I have you, and I always pick your brain. So I really appreciate it.
Of
Hey,
course.
everyone, this is Dr. Brad from Superior Chiropractic and Rehab Radio. Thanks so much. You guys have a great day. Where is the stop?